normal range. American Diabetic Association has also revised the guidelines, from a person who can be considered having a good control over normal sugar levels and pre-diabetic and diabetic. So anywhere around, fasting glucose level between 70 to 100, milligrams per deciliter is considered to be normal in the fasting phase. When I'm talking about fasting phase, it's definitely the fasting would be the first thing in the morning, where your blood sample is taken after around 10 to maybe 12 hours of fasting. So 70 to 100 milligrams per DL is considered to be normal in a person, who is non-diabetic. Pre-diabetic is a stage between normal and diabetic. So if a pre-diabetic person is not able to correct his lifestyle and other factors, would definitely be diabetic 5 years down the line. So pre-diabetic is basically a midpoint, where it can either reverse you to normalcy or it can progress to diabetes. So anywhere around 101 to 125 milligrams per DL is considered to be pre-diabetic. Diabetes, anytime, if I want to detect any point in time, if my patient is having sugar levels, fasting sugar levels 126 milligrams per DL and beyond that, is definitely labeled, and it can be labeled as diabetic. So, similarly with postprandial is basically 2 hours after I'm done with my meal, because your digestion process takes anywhere around 2 to 2.5 hours, to make sure that your sugar levels are just getting stabilized. And in case if you have some resistance with insulin, 140 to 200 milligrams is something which is a pre-diabetic range. Anywhere below 140 is like your normal, your insulin function is good. And anywhere which is beyond 200 is definitely termed as diabetic. So pre-diabetic category is also a form of diabetic category. So if I'm writing something on the prescription where my patients are into the category of pre-diabetic, they are known to be pre-diabetic, maybe the potential candidates for developing type 2 diabetes if they don't take it as a personal wake-up call. HbA1c, which is like very important marker, widely used. It does not need any fasting, and it is just one prick and you are done, you're sorted. Preferably it should be done on an empty stomach on a fasting level, early morning. But anywhere HbA1c ratio, where HbA1c is basically the iron, the molecule gets attached to the glucose molecule, and this is the most confirmatory, or one of the confirmatory tests done to make sure that diabetes is confirmed. So anywhere around, if you're doing good with the 5.6 to 5.7 range, is like absolutely normal. So it has a better glucose control. Like your insulin is able to control your glucose better. Pre-diabetes is 5.6 to 6.2, and any value beyond 6.2 is considered to be diabetic. The best thing about HbA1c, because it gives you average for 3 monthly, so it's like a quarterly thing. So it gives you, and that is why this test is repeated after 3 months. What are the diagnostic tests? As I mentioned earlier, that HbA1c is one of the tests. Fasting sugar, postprandial, urine routine is also taken into consideration. I have not mentioned it here for the simple reason that not every healthcare provider follows this protocol of just to make sure that there is detection of sugar or glucose in the urine sample or not. And in few cases, of course, CRP level stands for C-reactive protein. C-reactive protein is an inflammatory marker, so which is done, at least I make sure that I'm doing it for all my diabetes clients, especially for the simple reason, there are 2 reasons behind recommending CRP levels to be checked. Is with diabetes, inflammation in the body is quite obvious. So it's very obvious that there is some sort of inflammation, which this marker will particularly tell me that if I'm prone to more kind of infections, and it definitely leads to slightly elevated levels of CRP. Second and most important thing is diabetic individuals are often prone to heart issues. They are at a higher risk of developing liver issues, blood pressure, heart ailments. So CRP marker is something, if from the start, if you're considering your CRP levels within the normal range, it is definitely going to help you to have a better lifestyle modification diet plan.